Hi everyone, my name is Dr. Charudatt Vaity. I have joined Wockhardt Hospital, Mumbai Central as Director of Critical Care. I have almost 20 years experience following my post-graduation. I was studying at Nair Hospital, just opposite Wockhardt, long time ago. After finishing my post-graduation, I have been working in UK specializing in critical care, and following that I came back to Mumbai almost 8 years ago, and I've been working at different hospitals at various senior positions before joining Wockhardt Hospital. I've been working in critical care for the last 15 years. I have worked essentially in general ICU, but I have very keen interest in advanced respiratory and cardiac failure patients. I have helped establishing ECMO protocols in my previous institutions, and I have been actively involved in transplant intensive care. So as the rainy seasons are here in Mumbai, we see the increase in the cases of dengue and malaria, which is a seasonal illness. Both these infections are transmitted by mosquitoes, and you see increased tendency of having dengue, malaria during the rains, because water is one of the places where these mosquitoes they lay their eggs and from where it propagates. Both these diseases are having fever as their main manifestation, but there is slight difference between how they manifest. So malaria essentially has a typical way of having fever, where the fever comes and goes, and you have phases where you feel absolutely normal, and then you have phases where you feel absolutely terrible high grade fever with essentially with rigors, where you get a lot of shakes. These patients, when they take early attention with their general practitioners or the hospital physicians, this disease can be diagnosed. There is a clear-cut therapy now which has been available for many years, and it is easily curable. As long as you take attention on time, the chances of developing complications with malaria are less now with modern medicines. Dengue, on the other hand, it's a viral illness. Malaria is a parasite. Dengue is a virus. This is again transmitted by a mosquito. Usually we tend to see dengue as the rain recedes and the water pools, the mosquitoes propagate. Dengue is special in the way that the fever is there in the initial phase, and what we call technically as febrile phase. The fever is there for the initial 3 to 4 days. After that, the patient has no fever, and this is the time when most of us will think that as the fever is gone, the person is better. But in dengue, especially in the afebrile phase, when the fever goes away, you start having internal dehydration. You start leaking water which is within your blood vessels internally, and that essentially, if it is not identified and taken care, this can lead to complications. So the difference between malaria and dengue is how the fever propagates. The problem with dengue is that there is no specific medicine. For malaria, there is specific medicine. For dengue, the therapy is essentially hydration, and more hydration. If you keep adequate hydration, then the chances of having complications are less. People who are elderly, who have health issues, they have more chances of developing complications, so they should take early attention. Fever during the rainy season should not be ignored. Make sure that you are adequately hydrated, and make sure that you take early medical attention. In terms of between the two diseases, malaria, dengue, which one is dangerous. Both the illnesses can end up with complications. There is a huge spectrum of how the disease manifests. One where you can have mild symptoms, just fever, headache, body ache, etc. And the other spectrum is that these patients can go into multi-organ dysfunctions. All the systems in the body can get affected: brain, lungs, heart, liver, kidney. To both these patients, both the diseases can manifest in this fashion. The problem with dengue is that we don't have specific therapy, so prevention is cure. Both the illnesses are mosquito borne, so how can we prevent? Make sure that your surroundings are clean. Make sure that there is no waterlogging where the mosquitoes can propagate. Make sure that you are using methods where you can avoid mosquito bites. So having mosquito nets, mosquito repellents, creams, etc. Trying to minimize the mosquito bites, have adequate clothing. And finally, if you have disease manifestation, then make sure you take early attention, especially people who are vulnerable. So Wockhardt Mumbai Central Critical Care Department is a huge department. I have recently taken over this department, but I can proudly say that the department is well organized. It has more than 50 intensive care beds. Intensive care beds does not mean just having a space and a cot, but it means that all these beds are having multi-para monitors, advanced monitors, which help us monitor the patient with close proximity. There is invasive monitors where we can monitor the blood pressure beat by beat so that we get accurate readings. Then we have the most important things apart from the beds and equipments is people. So we have intensivists who are present round the clock. What do you mean by intensivists? Intensivists are qualified super specialist doctors who, after finishing their medicine or anesthesia or emergency medicine, have done special training, advanced training into looking after critical ill patients. We have a team of 6 ICU trained doctors who are present around the clock 24 hours. So patients who come to the hospital would get attention by these doctors anytime they come. There are nurses who are trained in critical care. We tend to maintain 1:1 ratio for patients who are very sick, who are on the ventilator. Sometimes we even tend to keep ratio of 2 nurses to 1 patient, where the patient is having multiple organ supports requirement like dialysis or ventilator or ECMO. We tend to have average 1:2 ratio, a patient looked after 1 nurse. So that is the usual trend. Apart from this, the advanced facility which Wockhardt Mumbai Central is able to provide is at par with any international hospitals. We have facilities to perform renal replacement therapy, continuous renal replacement therapy, which supports the kidney in patients who are very sick, who are not able to tolerate dialysis as a normal person would do. We have ventilators which are well equipped, advanced monitoring within the ventilators. We have also advanced cardiorespiratory support, which is the best in the world. What we call it as ECMO. The ECMO service is something which provides extreme support to the heart and the lungs in patients who are very sick. So these are the facilities which we have in the hospital, and they are at par with any international hospitals which are provided. Apart from the ICU, the major aspect for the hospital is having excellent backup for all types of interventions. So be it cardiology, neurology, radiology, these are the places where intervention would be required, and these experts and these equipments are available for anybody who is sick and who needs immediate attention.